Thank you for joining us today for this Zoom media conference and Facebook live stream. Today, Windsor Mayor Drew Dilkens is joined by fellow regional mayors, as well as Dr. Ahmed from the Windsor-Essex County Health Unit for an update on COVID-19 in Windsor-Essex. They are joined by representatives from our local media, while everyone else is able to join us via Facebook live stream from the safety of home. Mayor Dilkens will provide some introductory remarks momentarily, followed by an update from today's panelists. We will conclude with questions from the media. A reminder that participants must turn your own microphone and camera on and off using the Zoom buttons in the bottom left-hand corner of your screen. Panelists, please ensure that your camera is enabled for the entire session, but only turn your microphone on when speaking. Media members, please use the chat function in the Zoom screen to request a question. And once the conversation has wrapped up, media members will be called on to ask questions and your microphone will be enabled. Thank you all for your attendance today and your participation, and I'll turn things over to Mayor Dilkens to start us off. Go ahead, Your Worship.
Thanks very much, Dana. Good afternoon, everyone. I'm really pleased to be joined on this call today by Dr. Ahmed, our Medical Officer of Health for the Windsor-Essex County Health Unit. Warden Gary McNamara is here, the Warden of Essex County, also the Mayor of the town of Tecumseh. And all of the mayors of the mainland of Essex County are here, including Mark Bondi, the Mayor of LaSalle, Aldo DiCarlo, Mayor of Amherstburg, Larry Snively, the Mayor of Essex, the Mayor Tom Bain from Lakeshore is here, Mayor Nelson Santos from the town of Kingsville, and of course, Mayor Hilda McDonald from the municipality of Leamington. And I want to thank you all for joining today's call. And as of November 16th, Premier Ford and the Ontario Cabinet made the decision to move Windsor-Essex from green, which was the least restrictive category, to yellow, the protect category of the province's new 5-color coded staged framework. Earlier this month, they introduced the new framework and provided guidance for how they would decide to move regions up or down on that scale. And I appreciate that they are surely making these decisions based on public health advice, on data and case counts coming from all regions. This recent decision should be a wake-up call for everyone in our region as well. And I know that the vast majority in our community have been following the rules throughout the pandemic, following the best advice of our public health officials, and for that I'm grateful. But it is very easy for even the most diligent among us to let our guard down. We've already moved up one notch in the wrong direction, and if we want to avoid being further restricted, we need everyone in our region and our communities to follow these guidelines. We know that this is an unprecedented pandemic, and we know what it's doing to our communities, our economies, our businesses, and our families. We know what it's doing to mental health in the region, our social connections, and the incredible impact that it's had on our schools and on our children. And we know we're fighting a long battle and that we cannot become complacent. Following the provincial decision, a meeting was held between the City of Windsor, Windsor Police, and the Windsor-Essex County Health Unit, where it was agreed that we would significantly increase police and bylaw enforcement beginning right away. We agreed that the time for general education is over. And we agreed that enforcement blitzes would be coming and that charges will be laid to those who violate these important public health rules. And this seemed like a good time to bring the health unit together with all the regional mayors to address the public. The combination of pandemic fatigue, the cold weather, and of course the holiday season really presents a concerning trifecta of issues that make this a good opportunity to talk once again about COVID and how we can help keep each other safe. And we've said, all of us from the very beginning of the pandemic, that this region stands strong by standing together, and that's certainly what we're all doing today. And with that, I'll ask our Warden, Gary McNamara, to share a few words. Warden?
Well, thank you very much, Mayor Dilkens, and certainly I'm proud to be here with our fellow mayors. We knew all along that obviously the cooler temperatures of autumn might well coincide with the second wave of COVID-19. And unfortunately, our worst fears have certainly come true. Cases are surging and are starting to grow here and surging across the province and the country. And this terrible virus, unfortunately claimed another of our local citizens' life for this week, bringing the total to 77, a number of fatalities in Windsor-Essex. Look, we need to act resolutely and without delay. And as individuals, and I can't profess this enough, as individual, all of us, as a region, we need to slow the spread of COVID-19 and keep it from overwhelming our healthcare system and further infiltrating our long-term care homes, where it could have a devastating impact. And we know what happened in the spring in many across Ontario and the country. And we need to protect our most vulnerable residents in our community. So most importantly as well, as individuals, let's start protecting ourselves. It's difficult to remember the fear and uncertainty that gripped us all when this pandemic began last spring. But we need to recall how we felt and how we reacted. The situation is just as grim now as it was then and is poised to get worse before it gets better. We locked our economy down in the spring and we declared a state of emergency, all of our communities. We worked remotely, we limited our contacts, we washed our hands, we stayed home when we were sick, and we flattened the curve. Now we have to do it again, each and every one of us. The difference, and the key to crucial difference between now and the spring, is that we know a lot more about COVID-19, and we've taken significant steps to secure sectors where it is likely to spread. The Ontario government, in partnership with agribusiness, announced this week a comprehensive strategy to protect our agricultural workers and the province's food supply chain. This three-pillared strategy will work to keep our farms in business and our workers and our communities safe. And so obviously it's a welcome development. Look, it was alluded by Mayor Dilkens. We're all suffering from pandemic fatigue. And I know we miss gathering with our families and our friends. And I know the warnings are getting tired and stale. But look, cases are surging and we need to react accordingly. It's not too late. Let's be patient a little bit longer. There is light at the end of the tunnel. We know there's vaccines on its way. So together, all of us, we can make a difference, and we need to buckle down and beat back this terrible virus by making smart, selfless choices. And we know we can do it because we've done it before. So wear your mask, wash your hands, stay home if you're sick. And we have the power as individuals to keep our community safe. And I'm imploring every resident of Windsor and Essex County to use that power to protect themselves and others. Dr. Ahmed, who has been a constant and reassuring voice throughout the pandemic, will now offer his perspective as Chief Medical Officer of Health. Dr. Ahmed.
Thank you, Mayor McNamara, and thank you for the opportunity to speak along with all of you in this very important topic, and rightly so this time. So I have a slide deck, and Dana, do you want me to share my screen, or you will be running the slide deck?
I'll bring it up for you, Doctor.
Thank you. So as the mayors have mentioned that the COVID pandemic fatigue is hitting us, and we are already seeing a second wave surging across everywhere, not only in Windsor-Essex, but also across the province, across the country, and across the world. It's a global pandemic, and we have had some opportunity to learn from it in the last 8-9 months. We have learned a lot. We have also learned what is working, what doesn't work. Early action, early intervention, it slows the virus. And maybe we can focus more on what's happening in Windsor and Essex, but also we have to recognize that through the strong actions of all the Canadian officials, public health officials, politicians, we are in a much better shape. We are in a much better shape compared to many of the countries of the world, compared to Europe, compared to US, compared to many countries that have seen the worst. The big difference is the early intervention, and early intervention, it pays off, and we are noticing that over the time, our cases and our fatality is much better than many of the countries of the world. So if we have the slides deck ready, Dana?
Forgive me, Doctor. I am having a little bit of trouble bringing up my share screen.
Okay.
If you do have it ready, you can go straight ahead and share your screen. Forgive me.
Okay, I will do that. All right, so I will, can you see my slides?
Yes.
Okay, perfect. All right, so just a quick glimpse, just building up on that what has happened since the beginning of the pandemic, and what we are noticing now. If you're looking at the weekly incidence rate, we have had our first surge that has seen the worst cases in our region, but and then we have seen a decline starting from week 32, and things were relatively better even in the last month. But in the last 2-3 weeks, we are starting to see an upward trend. And as we can see, week 44, week 45, week 46 has brought our case count to a level which is concerning and threatening us with more cases coming down the road, because this is exactly the pattern that everywhere else is happening. And up until week 46, our case rates went as high up to 41 cases per 100,000 population, which is really concerning for all of us. And week 47 is just started, so we're still in the middle of the middle of this week. And as we know, we already have at least 3 long-term care home facilities that are currently in outbreak, 1 agricultural farm that is under outbreak, and we have declared an outbreak in one of the school as well. So the trend is definitely concerning for all of us. And looking further into the breakdown of what has happened since the beginning of this October. And as we can see, there are most of these cases that we're noticing as a result of close contact, household contact, outbreak, and they're all represented in different colors. But the key piece is still is there are a significant community transmission that we can see in red. And everywhere that you're looking at the red in this graph is giving you the amount of community transmission that are happening. And that's where the concern lies. And most of the data that we have seen from many of the other regions is pointing out to the fact that people are getting a little bit careless, and they're not following some of these measures. People are still having many of these private social gatherings, which is a cause of concern for our community. And we have seen it from other regions across the GTA as well. So we really need to focus on how we can control many of these things. So generally, we have been talking about it for these messages, that if you are sick, stay home and get yourself tested. You always maintain a physical distance of 2 meters with everyone who is not who doesn't live with you. You have to wash your hands often, or use alcohol-based hand sanitizer. So those are the message that we continue to give. If you're outside, avoid touching your eyes, nose, and mouth as much as possible, and keep cleaning your hand. And as Mayor McNamara mentioned, face mask is very important, especially if you are out in the public, where there will be moments when you are close to someone else within the 2 meters boundary. So even when you're wearing the mask, it protects you from that. And always cover your mouth and nose with a tissue. So that's the general prevention message that we've been talking about it for some time. The other key learning that we have done from the other jurisdiction is how do we limit our gathering, because that's where the risk is. And one of the things that many people are thinking that, when I'm outside, when I'm meeting with strangers, those are the high risk people. But let me tell you, what we are noticing is the high risk people are even the people that you are meeting. And you may feel that, yes, I know this person, and but we also have to recognize that almost all of us right now, given this stage of pandemic, a lot of us are working. They're working outdoors, they're interacting with many other people, they're having close contacts with other group as well. So even your social bubble concept that we don't talk about it anymore, but there are these mini gatherings that are happening in multiple settings. So even the one that you are thinking about your close contact, they're not really your close contact, because they have every one of them have other close contacts as well. So what we are recommending is you limit your close contacts just to your household members when possible. And we recognize that there may be some other caregiving opportunity, maybe to your close family members who may not necessarily live with you, but they need your support. So we recognize that. So you limit your close contact to your household members whenever it's possible, and only get to people who need that support, but in a safer manner. Any kind of social gathering, what we're noticing is becoming a concern. So we are saying that, if unless it's absolutely necessary, do not attend those gatherings. Just try and avoid that. And despite all of that, even when the gatherings are happening, we have to recognize that there is a limit on how many people can attend, and it is enforceable under the Reopening Ontario Act. So under that, we know that any kind of unorganized public events and social gatherings, it's limited to 10 people indoors and 25 people outdoor. But that doesn't mean that we have to have those parties. This is like the maximum for some kind of major life events situation that people are experiencing. So that captures that. It's not just for hanging out and having a good time. So it's not about that. You must avoid those as much as possible. The limits when it comes to organized public events and gatherings, such as in the convention hall, banquet hall, so all of those are still restricted to 50 people indoors and 100 people outdoor. But they have to have all these appropriate public health measures in place. And even when we are talking about unorganized public events, people have to have those, follow those public health measures and maintain physical distance at all times. And when it comes to what we are looking to do is using all of these measures and set up some clear expectation, because we've heard and maybe some confusing messaging from what is coming down from the province, what's coming down from one agency versus the other. We want to make it clear that in Windsor-Essex, this is what we are dealing with. We are at the stage where we are looking for strengthening the measures. We want to make sure that people are following that. It's been 8-9 months, and I think it's not an excuse for anyone to say that they don't know what to do. So using that, and I've issued a letter of instruction under Regulation 36420, which would allow many of these enforcement to happen under the COVID-19 public health measures, and it includes everything, including any kind of planned protest as well. What we expect through the working together, as Mayor Drew Dilkens mentioned, with our conversation with law enforcement agencies, not only with the city of Windsor, but also with the rest of the county, is to work together to strictly enforce all of these, including social gatherings and municipal events, as we recognize that there may be many other municipal events opportunities. We should consider suspending all those non-essential municipal events. And as I mentioned earlier, minimize your close contact to your household members only. And again, recognizing that there may be some other close caregiver that we have to do. Minimize your visiting to any private home or residential premises, and any other any other type of activities that doesn't need to happen should be held virtually or canceled at this time. For the industries and workplaces, what we are expecting that for a workplace, yes, we recognize that workplaces need to open to enable the economic activities moving forward, but we also recognize that there may be many non-essential visitors that can be visiting these workplaces. So find ways to prohibit them, and just to stick to the people who are critical to run your workplace, and avoid any kind of promotional, any kind of other event that brings a non-essential visitor to your workplace. And the employers are encouraged to look for all the options as much as possible to work virtually. And there are some other measures that we put forward, including a mall. People are walking and drinking together while they're walking. No more of that. Personal service settings, we recognize that there are many services that are essential, but when working with people who are wearing a mask, it just puts everyone at risk. So any kind of services that requires the removal of a mask or face covering, then we're saying that that shouldn't happen at this time. And gyms and fitness center, we recognize the importance of physical activity, so they are continue to operate, but they have to follow the provincially mandated registration to enter the facility, no walk-ins, and making sure that they are doing a good contact information for tracing if needed. And for any of these facilities where there are games that are happening, we're saying that no spectators are permitted, except for any person who's under the age of 18 who is accompanied by a parent or a guardian or any other caregiver. And then extending it further, we know that there are many views about all these measures, and recognizing that, as much as people are thinking that, yes, it's their right to protest, but we're also in the pandemic time. It's not the time when things are normal. A lot of people are suffering as a result of that, and for the safety and well-being of the community. So that doesn't give anyone a free pass just on the name of protest. So we want to make sure that all of these, if it's happening at all, well, first of all, my recommendation would be not to hold this, because this puts everyone at risk. But if it's happening, there is a limit. There is a limit under the regulation, under the law, which is 100 people outdoor, and that's it. And if that needs to be enforced, it should be enforced. We also want to make sure that when you're protesting, when people are following those 2 meters physical distancing at all times. That doesn't, again, do not give anyone a free pass in the name of protest to violate any of these recommendations, including face covering, including staying home if you're ill. So we are working together with all our local enforcement agencies to prioritize the safety of our community and get us through. As Mayor McNamara mentioned, it's not the end of the world. There is a light at the end of the tunnel. There are many candidate vaccines that are showing promising results, and some of the countries are already started using those vaccines. So we have been in conversation with our province, with the in terms of planning for some of these vaccine rollout and everything to get everyone out of this pandemic and bring some kind of normalcy back to life. So we just want to make sure that everything is there, setting up a clear expectation, and people, if they are not following any of these measures, we want to just make sure that the message is clear that the time for education is over now. It's time for action, and we all need to act together. Thank you.
Thank you very much, Dr. Ahmed. Thank you to you and your team for all of their efforts. On Monday, the province announced the new strategy to prevent agri-farm COVID-19 transmission, as Warden McNamara stated, and that included 35 recommended actions aimed at prevention and control. The plan looks at which steps can be taken before workers arrive on the farm, once they're on the farm, and those that address farm worker housing. It certainly is a challenging sector for the region, and it's required a united front from all of us working in partnership with upper levels of government. So next, I'll pass things over to Mayor Hilda McDonald from the town of Leamington to update us on what's happening in the agri-farm sector in the county. Mayor McDonald.
Thank you, Mayor Dilkens. Both Mayor Santos and myself met with Minister Hardeman on Friday, and he gave us an update on the not changes, but the advancements in the thinking, if you will, and process and procedures to work with farms. And I think that's a giant step forward. Back in March, there was a hesitancy all the way around for many organizations to take the lead. It was like everyone was pointing in opposite directions. Maybe it should be you, and maybe it should be you. And we've certainly learned from that there needs to be folks stepping up. And that to me is the change now in the situation with the agricultural workers. I spoke this morning with Kristen Kennedy, the CAO of Erie Shores Healthcare, and she said that they are right now all working together. All the agencies that were slowly brought to the table back in March and April, they are now right out of the gate working together, along with the Health Unit, Ontario Health, OGVG, the Ontario Greenhouse Vegetable Growers, as well as OMAFRA. And that to me and to her is a huge difference. There isn't that gap in time that we took before. And couple that with the fact that the farms have learned that they need to be on board right out of the gate as well has made for, yes, there's been a spike in numbers, but it isn't as drastic as it was back in the spring. The numbers, as Dr. Ahmed said, have increased. Right now, that is one farm that has a number of locations in this region between Leamington and Kingsville. And there are some lessons to be learned there as well. But I do believe that we are much better than we were. There are some farms that are of concern to Erie Shores Healthcare, but they're being monitored. There is on-site testing being done for any farm that has concerns with their employees that are either symptomatic or have been cohorting with other folks that are symptomatic. I do believe we are in a better position than before, but we can't let up. No one can let up. The farms can't. And of course, we will be in a different situation again when they come back. Right now, we're in the process of many of the ag workers that come off from offshore. They are returning to home, and they will be back in January. So again, it will be a different presentation of events coming in the winter. But right now, Kristen said we are in a good spot. Certainly no one can let their guard down. They are being very vigilant. Again, the farms as well as all the organizations are as well. Thank goodness for our healthcare workers that they are still going that extra mile. They have been certainly diligent from the very, very beginning and are still keeping it up. So for us, yes, we are watching what's going on. We are cautiously optimistic. One area that still is of concern to myself is always the employment agencies that take workers from farm to farm. And that is something we all have to recognize as far as those folks that are working with the ag industry, health unit, as well as the provincial and federal governments, because that is a insidious way to bring that virus into a farm, and then to get rid of it is, as we've seen, difficult. So right now we are feeling cautiously optimistic. We have learned from our hesitancy in the past that we cannot be that way. We have to be ready to mobilize. Our Nature Fresh Sports Complex would be certainly ready, willing, and able if we get to that point in time. There are a fair number of folks being housed in the isolation center in the city. Again, there are some questions there as to who's being housed. I'm not sure if those are the folks that are positive tested, or if they're trying to keep ones that are more sensitive and high risk there. I'm not sure of that. But anyway, I do feel that we are in a good spot.
Well, thank you very much, Hilda. Certainly, Hilda, much more positive than at the start of this, and I think we're all tracking in the right direction. And before we move on to questions from the media, I certainly want to open the floor up to my fellow mayors, give them an opportunity to add to the conversation or provide any information you want to share on behalf of your community. So I'm not sure who would like to go first, if anyone, but Mayor DiCarlo in Amherstburg.
Thank you. I think everything's been articulated quite well as far as the current status, the restrictions, and everything else. To avoid being repetitive, I just want to say that the town of Amherstburg supports all of the restrictions and all of the other regions, all the municipalities in the region, and working together to get this through this and keep this from spreading. And to all those who are following the restrictions, I just would like to say thank you. And to those who aren't, for whatever reason, especially apathy or fatigue, please follow the restrictions. And that will get us through this a lot quicker. If we don't, then I'm afraid it's just going to extend this further and further past the holiday season. Thank you.
Good comments. Thank you. Mayor Bain.
Thank you, Mayor. I too will keep it short, but I think the message is so important, and the message that we're hearing today is one that certainly Lakeshore's backing 100%. And I want to really begin by thanking Dr. Ahmed for a great job and his staff. I know certainly there's those out there who just will not support the movement, and I know it's got to be tough, and so glad to see the great job you're doing, Dr. Ahmed, and your staff. And I know there's got to be a lot of stress there. I know as mayors we're feeling it, but you're right there on the front line, number one. So great job you're doing there. And I think you only have to look at the rest of Ontario and look across the border and see the numbers there. And I think the majority of our residents can give themselves a little pat in the back. But the message today, I think, really is don't let your guard down. It's so important. And in fact, one of the things here in Lakeshore we're doing is we had a stroll the streets planned again. We've dropped it. We've stopped it. Any of our festivities that we were planning with this second wave here now, it's so important to keep that guard up, stay strong, and convince your neighbors that wearing that mask, social distancing, all of the other regulations are so important. So behind everyone, and keep up the great job.
Thanks very much, Mayor Bain. Mayor Bondi in LaSalle.
Thank you. I as well will keep it short, but just a couple points. I mean, there are the carefree, careless people out there that say, I'm going to go where I want and not wear a mask. Yet you have to respect the public place they're going to, whether it's a private store or a business, and they have a right to protect their employees by insisting you wear a mask or you don't come in. So there's two sides to that. I just want to make a comment in relation to the support from our local policing. I had a discussion with the chief once it was announced we were in yellow, and I asked him specifically, will you be doing enforcement? And he said yes. So he's on board. He will be enforcing. We only have so much manpower, but the ones who do get calls, they said they will be enforcing the rules and the regulations, and they will be issuing fines. So welcome to LaSalle, but if you're not doing what you're supposed to and you're not following the guidelines and the police are called, they will be visiting wherever you're at. So I caution everyone, this is not a threat. It's just that we have rules to follow and we will be following those guidelines. So let's stay united, stay strong, and stay safe, everyone.
Thank you, Mayor Bondi. And to your point, I believe Dr. Ahmed, I'll stand corrected, but I believe the fines that are issued, I believe, start at $750. So this is not a small fine that one just pays very easily. This is actually a very painful fine to receive. So it I think underscores the importance of the issue, which is why the fine is so high, that the matter is very serious and we're asking people to follow the rules. To the town of Essex, Mayor Larry Snively.
Thank you, Mayor Dilkens. First of all, I want to thank the Dr. Ahmed for putting these restrictions in place. You're doing a great job. To the town of Essex, we did have a big outbreak here on one of our homes here, and I just want to thank the frontline workers for all they did to keep us safe. They're keeping people out of the home. They're following the rules, and once again, I'll repeat what everybody said. Wear your mask. Wear your mask. It's so important. We got to stop the spread. Thank you.
Thank you, Mayor Snively. Mayor Santos, Mayor McDonald, anything else you'd like to say? Mayor Santos?
Yeah, just quickly, I mean, everyone's really covered the importance of what it means. I mean, yellow doesn't change a lot of our mobility. It certainly raises the level of protection. And that's what we're talking about, is getting our guard up, protecting against any, unnecessary spread, and working, I think, collaboratively and recognizing our surroundings. I'm thankful to all of our user groups in our community, from our skating teams to hockey, the parents. They're being very responsible at all of our recreation centers. We want to be able to maintain some level of activity, and it's key that we don't let that guard down, has been noted, and we're going to continue to work and keep an eye on the progressive safety for us in our region.
Thank you very much, Mayor Santos. Mayor McDonald?
My only concern, and I'm just bringing this up because it is a concern in my municipality, so I don't want to whitewash it. We've certainly had a lot of issues with anti-maskers using the religious reason for not wearing masks, and it's been quite problematic. I certainly wish the province would step up and allow that not to be an adequate reason. We've been threatened with a lawsuit, as have some of our businesses, because of it. And it is causing a problem for businesses as well as for enforcement. I had sent an email to Dr. Ahmed to tell him that is peculiar to our region, perhaps, since I've not heard anyone else mention it. So again, enforcement is great, but when there is that loophole, we sometimes get caught up in the tangles of that. So I just want to put that out there, that we are having an issue with that.
Thank you, Mayor McDonald. Warden McNamara.
Thank you very much, Mayor Dilkens. And the one thing that I want to, I guess, to bring forward, and I think I'm going to bring it tonight at our county council meeting as well, is that in the order, or that the Premier was flanked by the Solicitor General and Minister McNaughton in the announcement in terms of the enforcement piece and so forth. There's a bit of a conflicting information in terms of the direction that the OPP are using, where they still want to, the carrot versus the stick. And I'm concerned with that. And one of the items that I brought up under our meeting we had just the other day with our emergency management team at the county, and it was shared with obviously the LaSalle police and also City of Windsor. And we need to find uniformity in delivering the enforcement within our region. I did pen a letter to the Solicitor General to make sure that the commissioner of the OPP understands the directive. And it makes it much more difficult in a region like us, where we're police from different entities, where we have Section 31s, Section 10s, and a hybrid in the town of Amherstburg. And so we want to be all on the same page in that regard. So I'm going to be asking my council tonight, basically also, as I did here, the town also to clarify from the province the enforcement rules, especially when the OPP police 323 municipalities in the province of Ontario. But in I'm more concerned with my region, our region here. And at any opportunities, Mayor Dilkens, or certainly to my colleagues on kind of council as well, as we have that opportunity to get the clarity to make sure that we're all on the same page. Because at the end of the day, after 9 months of pleading, asking nicely, politely, and so forth, sometimes, tough love has to take the bull by the horn, so to speak. So, in the items that Mayor McDonald just brought up as well, is that we're all faced with that in our individual communities. There are some out there that are using whatever loopholes. I know the health unit, I think we're in a class action suit as well across the province, not only our unit, but others that are enforcing those rules. So the enforcement piece, we've got to be uniform across the region. And I'm happy to hear LaSalle saying that they will enforce it. The city of Windsor are going to enforce it. I hope our other 5 municipalities, and Amherstburg the same, and the other 5 do the same. I think it's critical.
Yeah, good point, Warden. And we're at the point after so many months of doing this that we have done so much education. And I think the majority of people in this community are sensible, are following the rules. The numbers certainly play that out. And the time to educate is over. It's time to educate bank accounts. And I'm afraid that that's going to be the only way to make sure that we can keep numbers low, at least in the very short term. And I think, like any employer, the city of Windsor, we're taking our yellow protect level status very seriously. We're limiting our city council meetings to Zoom format only for the foreseeable future. We're pausing on adding any more recreation services or classes to what's already on offer, and we're reviewing the current offerings with the health unit in case anything needs to be suspended. We're also continuing to have as many municipal employees as possible work productively from home. And personally, in discussing with Dr. Ahmed recently, I've been reflecting on my own behavior and practices, and I'll be taking on more virtual meetings to limit interpersonal interactions. And so I already spend a lot of time, like all of you do, on Zoom and in virtual team meetings, but I've taken some meetings in person at City Hall, and we're going to limit those meetings significantly based on the advice from the Public Health Unit. We all need to question and limit our social interactions right now, folks. That's really the way through this. And this means that the house parties and the social gatherings, the birthday celebrations, the family get-togethers, I get it. It's the middle of November. As we roll closer to December, these are the types of things that we're used to doing year after year. They feel good. They give us a sense of closeness with our friends and our families. But right now, social functions should be limited to individuals residing only in your household, period. Cancel, postpone, or hold virtually any other discretionary in-person activities, or participate only with your household and essential supports. And while you're doing that, you can still find safe and effective ways to support businesses and the organizations that certainly help this community all year long. It's certainly difficult, as the warden said, but it can be done. And it will take all of us working together to get where we need to be. So thank you all for being here on the virtual table today, and for everyone watching from home. With that, I'll open the floor to questions from the media, and I'll turn it back to Dana.
Thank you very much, Mayor Dilkens. Our first question comes to us from CTV. Go ahead, Sonia, and enable your microphone.
Good afternoon. Can you hear me?
Yes.
Perfect. I have a question regarding the COVID-related fines and enforcement. Have you seen an increase in fines since we moved into the yellow stage and put more emphasis on this?
I'm happy to share with you at least the initial reports from our chief of police. Speaking with her yesterday, she actually dedicated certain members in our POP unit to this enforcement activity solely over the weekend, and they went to a number of locations, but everyone was compliant, and the places they went to, everyone was in order. And so even though we received complaints, the complaints were not found to be valid. but police did attend and were prepared to issue tickets. So I can tell you they did not issue any tickets over the last few days related to violations under the legislation.
Follow-up?
You mentioned that you would like to see uniformity across the region when it comes to enforcement, especially as we head into the holiday seasons. How does that look like exactly?
I don't know if you want me to take that question, Mayor Dilkens. And thank you certainly for the question. The messaging, coming, I think, from the leadership table at the provincial level was quite clear in terms of the enforcement. But I'm not 100% sure that messaging is coming directly through Aurelia. And I with certainly the letter I sent is I want some certainty in terms of having continuity across the region. So you can imagine if the city of Windsor or LaSalle and Amherstburg are issuing tickets, and if there are offenses, and it's not so much in the rest of the county. Well, I don't want them to say, well, let's go to Essex, for example, and we can do what, and then we're not going to get a ticket. We're going to get another warning. And so the basis here is to have far more clarity at the local level. And we're trying to tell, obviously, police services, but most importantly, the province, is that I think between the city, I could be off a little bit, but I would say between the city and the county, I don't even know if we have 20 bylaw enforcement officers. I think the city has about 12, maybe. We've got one, and I think the majority of the municipalities have one, maybe two, or four, and I mean, we have one. And so, one to deal with 25,000 people, the numbers are just not there. So you need the cooperation with all enforcement. And so I want to make sure that we're all on the same page. And it doesn't matter which four corners in the region you're at, you're going to be treated the same. And if you're going to break the rules and put people at risk, then there should be consequences for that. And there shouldn't be just oh, well, sorry, I didn't understand or I didn't know. After 9 or 10 months, we should all be aware.
Thank you for the question. The next question comes from AM 800. Rob, go ahead, enable your microphone.
Gary, just to follow up to you as chair of the health unit and the warden, do you think law enforcement delayed this process? Do you think fines, charges should have been issued a lot earlier? Like you said, it's been 9-10 months now.
Well, we've had some circumstances here in my own community with Airbnbs, and to give you examples where we had 40 to 50 people in one facility during COVID, and these folks were coming in, young folks coming in from Toronto and the GTA area, and so I think the messaging were the neighbors were frustrated, the council was frustrated. There's only so many things that we can do in terms of enforcement, and to the point where we started adopting, I think, the Airbnb regulations that the city of Windsor is looking at and adopting, I think, and so forth. So, it has to be laid out quite clear. How many times, if I'm speeding down the expressway 100 times and I get pulled over and they say, please don't do it and carry on, guess what's going to happen? People are going to carry on. And so I'm not saying everybody, and I don't want to paint a brush with everybody in the community. All of them have been very, very good, but it's those out there that want to push the limit, and they have. And so we want to make sure that the enforcement of the rules as we progress, and hopefully we don't go beyond the yellow, are met with uniformity throughout the region. And so I certainly want the Solicitor General to clarify and send a message to our commissioner, and so that memo comes down to the rank and file. The rank and file will only follow the rules that is given to them by command, and so we want to make sure that we follow the same rules.
Follow up?
Hilda, for you, you mentioned how the masks have been an issue. What have you been noticing in your community? People are out and about and not wearing not wearing the mask because of the religious aspects?
Yes, Rob, that's the reason they're saying it goes against their religious beliefs. I've had a business owner from a major chain store call and ask us what he should do. Well, our bylaw does not allow for religious exemptions, but the health unit as well as the province do. So that is what the one lady in particular has been flagging. Our advice was to get his own legal advice, but I gave him my personal point of view. When I had my business, I always made sure my employees stayed safe. And we told him also that if he wanted to keep his employees safe, as long as he offered an alternative way to shop, he should be fine. And he's going to continue doing that. He said if he opens the can of worms that allows religious exemptions or religious excuse, his place of business would be inundated with folks with no masks. Just right now, it is a problem for us. And you go into particularly the larger grocery stores and these folks are walking around in defiance. And it just is unfair. It is making our folks who are complying with the rules and regulations angry. And I would just like to see someone step up, and I'm talking higher levels. I'm talking the province to say, no, that's not a good enough excuse. This is a health issue. This is not a religious issue. Freedoms, whatever it is, this is a health issue. You have to wear a mask.
Thanks, Rob. The next question comes to us from Stacey Janzer. Stacey from CBC, go ahead, enable your microphone.
Hi, I was wondering for Hilda, you had talked about some farms being monitored by Erie Shores. How many farms are being monitored?
I'm not sure, Stacey, but the number is not large. I believe Kristen said there were maybe 2 they were keeping an eye on just to make sure that there isn't an outbreak. But she was not terribly concerned with those numbers, just saying that they are ever vigilant because the time of flu, and usually she said heart conditions tend to increase the probability of heart conditions becoming an issue for folks. This is the time of year for it, so they're vigilant because of that.
Follow up?
When it comes to enforcement, I just wanted to make sure, are we now making sure that we are giving tickets out? Like, is that what we've all decided on at this point?
Yeah, I'm happy to start and everyone else can jump in. I think it's fair to say we all agree that enforcement is more appropriate now than ever. Over 8 months, we all understand the rules. And if anyone doesn't understand washing your hands, keeping distance, and wearing a mask at this point, I'm not sure that there's much more that anyone on this call or anyone in the community can do to help get compliance other than move to enforcement. And so all along, I think police, bylaw enforcement, the health unit inspectors have taken great measures to try and be reasonable, recognizing that the magnitude of the fine involved here is not small. It will have an impact on someone who receives a minimum $750 fine, and it's $750 and up. I mean, it can actually go to $5,000 and $10,000 in certain circumstances. And so I think the point here is there's agreement that enforcement is necessary to make sure that we don't see this thing explode to a place that none of us want to get to. We worked so hard to dig ourselves out and to get out of stage 2 into stage 3. And now we see us slipping back slowly. But if you look what's happening up the 401 in Toronto and the GTA, in Ottawa, if you just look what's happening 2 miles away from my office over in the city of Detroit and the state of Michigan, if you look what's happened in Europe and what's going on, I think we would all agree that the alarm bells are ringing, that the red flag is flying, that we need everyone's diligence and attention here to make sure that we don't get to a place that none of us want to get to, because we've all collectively worked so hard over the last 8+ months. And so because the majority of people are being sensible and reasonable and are following the rules, our numbers have been, I would submit, fairly decent compared to other areas in the province. The problem is we're on the tipping point and we don't want to go backwards. And so for those who are not following the rules, who aren't sensible, who aren't being reasonable, if the only mechanism we have to gain compliance is enforcement. I think, I certainly don't want to speak on behalf of my colleagues on the screen, but I certainly think that that's the most appropriate mechanism if they won't voluntarily comply. As was said, this is a health issue. This is a health issue. This is not, this is not about freedom of, wearing a mask or not wearing a mask. This is about keeping everyone in the community safe. And that is all our collected responsibility and our goal on the screen, but that's should be our responsibility as humans, as friends and neighbors and colleagues of everyone in the community. We want to keep everyone safe, and we're all in this together, and we're going to get through it together, but we all need to have some shared responsibility here.
Thanks, Stacey.
I just want to add one little point to Mayor Dilkens as well. Is you want to kill the economy? It doesn't take very much. When you see positivity rates in across the river as high as 50 and 60% of their population. And I think Dr. Ahmed alluded to some certain areas where we could jump to 9 to 19%. That's why I think us as individuals, the majority are doing a great job. And you know what? We do not backslide on this. The enforcement's a key piece because we know how quick the infection rate can expand. And that's the scary part. And we want to certainly be ahead of this thing and not behind it. And this is why I firmly believe that if you're going to take that risk, then you should be prepared to pay the consequences, because I don't want to see our businesses close. I don't want to see our business, like our tourism industry has suffered. Our restaurants have suffered, and they still are. And this could be the last nail to drive that coffin shut. And pardon the pun, in saying that, but that's the reality we're faced with. And if it means driving a message hard to individuals to pay attention, then so be it. That's what we need to do. We need to, to help the majority of folks continue to march forward until the vaccine is in place. But we're probably 6 months to a year away before we can start actually looking in the rearview mirror. But in the meantime, it's important for us to be as tough as we can where we have to be.
Well said.
Thank you. Our next question comes from the Windsor Star. Belson Chen, go ahead, enable your microphone.
Hi, mayors. This might be going over some territory that you've already covered, but just to hammer down on the point, there is a contingent of our community who cannot be reached, cannot be reasoned with on this particular issue, and are vowing defiance. What can be done to reach them, and why do you think that they're so intractable? Can you hear me?
Yes.
Yep, we can hear you.
Okay.
I don't know that I have all the answers to your question. Certainly, I've thought about this a little bit, trying to figure out how to reach the average person and what we might be able to do to gain compliance in a reasonable way with these folks. And it just seems like there is a small but loud group on social media who is committed to, they believe they're committed to enforcing what they believe to be constitutional rights, but they do so over the, they do so without thought for their neighbors and their family and their friends. And they do so without thought to the current circumstances in which we all find ourselves, and that's in the middle of a global pandemic, none of which are something neither of us or any of us have lived through in the past. And so I can assure you that the last thing I would want to do, or I've heard people say this is an attempt of government control. I can certainly assure you that if I was trying to gain control in some dictatorial way, the last thing I would do is tell you to wear a mask. I don't find that to be sensible in any way. And so what we're trying to do is listen to Dr. Ahmed. We're listening to experts at the provincial level. I'm listening to Dr. Tam at the federal level. And I, like everyone on this screen, is taking in everything that's happening around us, all of the data and the facts and the best practices. We're trying to give advice that we think is going to keep the public safe. It's advice that I follow. It's advice that my family follows, because we believe it's the right thing to do to keep us safe and to keep our neighbors and other family members and the people we interact with at the grocery store or Costco or elsewhere, to keep them safe as well. And so I don't know that there's a way to reach these people. I think some are just in protest mode. And I think some may be also suffering the effects of being locked up, being sort of locked down for 8 months in the way that we have been, where that does affect different people in different ways in terms of mental health and the way they perceive the situation that they're in as well. And so I'm trying to find compassion for those folks. I'm trying to reason with them and trying to get them ultimately to comply in a way that will help us get through to the point where we can get that vaccine and all move on with whatever we call the new normal, whatever that looks like, but get to that point where we're all inoculated and can move on in a safe way and get back to the activities we're used to enjoying.
I'm just going to add a quote from President-elect Biden, and he's used this on a few occasions, talking about their numbers, but we're going to talk about our numbers. We've got 77 people in our region. That's going to be an empty chair at Christmas time. There's going to be a missed birthday, a missed anniversary, a missed graduation. And there's 10,000 of them in Canada in the same reason. This is why we're doing what we're doing. And for us to be able to accept, it could be your mother, it could be your sibling, it could be your neighbor, it could be your best friend. At the end of the day, this is the reason why we're doing it. And the best way for us to protect each and every one of us is very sound, basic science. Basically, wear the mask, wash your hands, social distance. That's what it's all about. And I know you don't want to be the next one to say you're going to miss that person on those special days during the year. That's what it's all about. And so by being patient again and just knuckle down, and so forth. Or even think about, our veterans, for example, who just recently, we were there November the 11th. Why we celebrate them? Imagine them for 5 and 6 years, the sacrifices they made and their families and so forth. Do it for them, or do it for somebody that's ill. Do it for a friend. That's the messaging I'm trying to tell those folks why we should be doing. But you certainly don't want to have that empty chair at the next celebration.
Thank you.
Felsen?
No, thank you.
Thank you very much. Our next question comes from Stacy Janser. Stacy, go ahead, enable your microphone.
Dr. Ahmed, numbers are showing that we're in orange right now. We're nearing red for provincial guidelines. Are there more regulations coming?
So we are monitoring those numbers very carefully. And as I mentioned that we already have declared an outbreak in one of the schools. And we have a farm that we are also managing an outbreak in that farm at this time. On the same note, we are seeing some increase in the community transmission. So all these numbers we are monitoring, the province is also monitoring, and it all depends on what the next few days bring for us and which direction we would go. At this time, obviously, it's too early to even say that whether this is a consistent trend. We have seen some numbers going up based on these controlled outbreaks, but I think the next few days are critical for us to see where we are going and whether we need more measures or not. And we will be in contact with the province to have a discussion on what's these numbers mean locally and what can be done to control it and contain it as much as we can.
That's all I have. Thank you.
Thank you, Stacy. Our next question comes from Rob Hindi. Rob, go ahead and enable your microphone.
Sorry, just a quick one for Dr. Ahmed. Dr. Ahmed.
Rob, can you hear me?
Can you hear me?
Yes, go ahead.
Okay, perfect. Sorry. Dr. Ahmed, just a quick one for you. In your presentation, you talked about the planned protest. I know they've been happening on Sundays. I just want to get
Forgive me, we're having some technical difficulties. Rob, please go ahead and enable your microphone.
How about now?
Good.
Okay, perfect. Sorry. Dr. Ahmed, with these planned protests, like you mentioned in your presentation, if they have these planned protests, and obviously they're fighting the mask and other regulations, if they are social distance, can they hold these protests? That's where I'm just getting a little confused.
I guess it's again some of these things that we definitely look to our law enforcement agencies to provide their input as well. So every time this happens, we work with them. From a recommendation perspective, if I can speak to it, I'll say no, you shouldn't be having any of these things because first and foremost, like even when Mayor McNamara and Mayor Dilkens was making a comment about these protests. So let me just ask you a simple question: what are you trying to get at? Do you think that with this protest, you will get everything back to normal? No, you cannot. It will further lead to increase in cases, and it will lead to further shutdown. If that's the goal that you're trying to achieve, maybe you're achieving that. But these type of protests, it's not going to go get you anything that you are trying to get. So the key message is still, even let's say if you disagree, if you think that this virus is a hoax, it doesn't exist, and all this is a big scam, and all of these people, the entire world is buying into something which is a big lie, or which you can think about that. But what is the ask here? The ask is very simple. You can do whatever you want in the comfort of your home. When you are stepping into any public space, you have to follow the rules. So that's as simple as possible that I can explain. So we really would work closely to see how we can do that education and enforcement. And for the general public, I would say that don't, because this puts the community at risk. And I've seen little children attending those gatherings, and it's unbelievable for me when everyone is trying to protect everyone, their loved ones. And how can you bring your even children to these type of gatherings where you are exposing your children to these type of events and these type of activities? So it's really unbelievable for me.
Thank you.
Thanks, Rob. If there are no more media questions at this time, thank you for your attendance. I'll turn things back over to you, Mayor Dilkens, for closing remarks.
That's all I have, Dana. To my colleagues, thanks very much for being here today. A great conversation, and I hope you all stay well, stay safe, and we'll talk to you again very soon. Thank you very much.
Thank you.
Right.